Honorable, the majority leader, because of President.
Thank you, Honorable Speaker. Honorable Speaker, let me first take this opportunity to thank the Honorable Dr. Lydia Ngogo for this adjournment motion, because it gives us the opportunity to address a very topical issue in our country. Honorable Speaker, maybe allow me to start with a bit of statistics that I have just gathered, Honorable Speaker, that so far, a total of 14.4 million Kenyans have registered to join the Social Health Authority program under the Social Health Insurance Fund. Out of this, today alone, I've just confirmed from the CEO of SHIF that 104,000 Kenyans have registered today. And allow me, Honorable Speaker, to plead with us as members of Parliament and as the people's representatives to be at the forefront in encouraging, promoting the registration of members of the public into the Social Health Insurance Fund. It may be politically expedient and very politically correct to speak to the gallery of how things are not working, but as we speak to Kenyans on how things are not working, let us remember that Kenyans have charged us with the responsibility to make sure that things do work for them. It therefore doesn't help me. Remember St. Peter's health facility there that mushroomed into a big health institution largely from money stolen from NHIF. You remember the other small dispensaries you saw in Tharaka Nithi, in Meru, in Nakuru, and people are hemorrhaging resources from NHIF, Honorable Speaker. It is these hemorrhage resources from NHIF today, Honorable Speaker, that largely are fueling the propaganda you see being peddled against the Social Health Insurance Fund, Honorable Speaker. Today, Honorable Speaker, out of the 14.4 million Kenyans who have registered, 710,000 have done the mean testing score. And out of these people, Honorable Speaker, when you register, Honorable Speaker, and these are the things we need to be telling to members of the public. The moment you register today are telling us that the main premium that Kenyans who have done the mean testing score of these 710,000 is 525 shillings. Because it is politically expedient and politically correct, Honorable Speaker, for me as a business person who is well-meaning, who is doing well, to do the mean testing score, and I'm told the premiums you should pay from your level of income, and also people to know that it is based on how you answer the questions that are on that mean testing score. If you own a car that you are paying insurance of 200,000 shillings, for heaven's sake, if you can insure an automobile, you can also insure your own body, your own health. And therefore, Honorable Speaker, you find people who are quoting very huge figures. But because of the answers they gave as they did the mean testing score, fact, Honorable Speaker, and these are statistics that you can examine and see and authenticate from the SHA website, Honorable Speaker. The mean premium out of the 710,000 people who have registered is 525. Out of the service providers, Honorable Speaker, 7,802 hospitals have signed up for this program. Honorable Speaker, there are a further 8 6,118 healthcare providers who have successfully registered to offer services, and out of this, Honorable Speaker, 7,965 have offered services under SHIF to Kenyans. Therefore, for us to stand here, Honorable Speaker, in this house and elsewhere, in funerals and everywhere, to say, oh, it is not working, we are lying to Kenyans, Honorable Speaker. We should be telling Kenyans the truth. We should be educating Kenyans. And I know we may have failed in our communication strategy. We may have failed in how well we communicate and educate our people. But, Honorable Speaker, let us use this opportunity on this floor this evening to educate our people and let them know. Honorable Speaker, it is not fair that my constituents, who some are people who are unemployed, were paying an average of 500 shillings at a time with my huge salary, Honorable Speaker, besides my business income, Honorable Speaker, and that salary is paid for by the same constituents that I was paying 1,700 shillings a month. And now, because I'm being asked to pay 27,000 or 20,000 shillings a month, I start complaining and cry more than the bereaved. But I'm not being honest with Kenyans to tell Kenyans I am crying more than the bereaved because I am more bereaved because I am paying 20 times more than what I was paying from money that is paid to me by Kenyans. That is the kind of honesty, Honorable Speaker, I want to beg that we exercise as we debate, Honorable Speaker, as we educate. Let us be at the forefront of offering civic education to our people. Because, Honorable Speaker, you have seen cases of cancer patients. You've seen renal care patients, those who are undergoing dialysis, and yet I had paid for all men HIF. If you are unemployed, the moment you sign up, automatically you can access a level 1, a level 2, a level 3 hospital without payment. The capitation that is going to the hospitals, the facility improvement fund. You know, I was so embarrassed, Honorable Speaker, over the weekend when I had a member of parliament pretend in Kikuyu that this SHIF or SHIFO, and saying it is not this SHIFO. SHIFO is a name for a chief. A member of parliament saying that they do not know the difference between SHIF and SHIFO. Yet, you are seated in this house, you legislated, right from the first reading to the third reading to the committee of the whole house, you are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between SHIF and SHIFO. That you do not know the difference between SHA and SHIF. Honorable Speaker, I am saying I was so embarrassed because I would expect a leader elected by the people believing that that leader knows more than them, to be using that opportunity, Honorable Speaker, to educate their people, to tell them that if you have need to access renal care and dialysis at your dispensary or at your local level 4 hospital, all you need to do if you are unemployed is to do the mean testing score. You are advised how much premium you should pay. When you pay, Honorable Speaker, and I know these are the cries that Kenyans have raised, that the mean testing score is asking you to pay for the annual premiums for the whole year. That was the case under NHIF. You could not access renal care, cancer treatment, without paying your annual premiums, Honorable Speaker. And Kenyans were paying. Today, Honorable Speaker, because SHA, or the Social Health Authority, is yet to activate the insurance premium financing, they have now opened it up to Kenyans to be able to pay every month. Let us educate our people that you now can pay monthly premiums, access your dialysis, access your cancer treatment. Let Kenyans know that today under SHIF or under the Social Health Insurance Fund, they can access dialysis, they can access chemotherapy, radiotherapy, free of charge if they are registered with this authority, if they have paid their premiums. It doesn't matter whether it's annual premiums, If you have access to insurance premium financing to pay your annual premiums, pay. If you cannot, discuss with them and pay your monthly premiums. Access those services. Honorable Speaker, my last point. Our county governments and our county governors, and I really want to plead with our county governors. And their CCs. You can give me
a minute only.
In a minute, Honorable Speaker, if our CEC's healthcare in our counties can take up the challenge, because other than the Kenyan public who are the major beneficiaries of this SHIF, Honorable Speaker, is our county governments. The Facility Improvement Fund that we legislated in this House, I know many politicians will not tell Kenyans that truth, that facility improvement facility empowers your local dispensary to have a committee that will even procure equipment and medicine at that local level. It is the number of people who are registered in that locality and who are registered to that facility that will enable the facility in your locality to access the Facility Improvement Fund that will ensure that a hospital in Gatuna in Kikuyu, the far-flung corner of my constituency, the most remote part of my constituency, if they have a dispensary, Honorable Speaker, they will be able to access the Facility Improvement Fund, be able to equip their dispensary, have medicine available at the dispensary, have money to hire doctors, and we legislated. We made it possible in this House, Honorable Speaker.
Thank you, Majority Leader. The Minority Leader will take precedence over you. Honorable Andrew Kwome, the Minority Leader will take precedence over you, the Minority Whip, for the avoidance. The Minority Whip.
Thank you, Mr. Speaker. And I want to thank Honorable Lilian Gogo.
Honorable Millie will always speak before you, whenever she wants.
Though that is discriminatory, because the tallest man should be speaking before. But Mr. Speaker, having said that, I want to thank Honorable Lilian Gogo Honorable Dr. Lilian Gogo for bringing this before the House. And Mr. Speaker, I just want to say that under Article 43 of our Constitution, it provides for the right to health, to the highest attainable standard of health care, including reproductive health care. And legal framework, a new legal framework that replaces NHIF, and we passed 4 bills. And Mr. Speaker, I was in the House when those bills were being passed. I was especially opposed to certain parts of that bill, but that is now water under the bridge. We have a new legal framework. Mr. Speaker, having listened even to the members, the honorable members as they move, Honorable Kimani Chungwa and even the Honorable Nyikala and the Chair of Health Committee, one of the things that I can indeed say is that the proof of the pudding is in the eating. So it is actually too early to even say, we would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later. However, we can see photos of people who are in hospitals who are struggling to access health care. Those with renal issues, those who are cancer patients. And Mr. Speaker, even though I know Honorable Ichungwa is actually castigating a lot of the members who he says are pushing propaganda, he's saying one. I don't know who that is, since I'm not too sure. But I'm not very keen on the politics of the mountain. But Mr. Speaker, what I want to say is that we need to acknowledge that there are very serious transition issues over this. And Mr. Speaker, if we lose a life, we can never regain it. I have a person who is very close to me who is undergoing cancer treatment right now and will not receive any treatment unless there's pre-authorization of payment. And Mr. Speaker, if me, I'm at the place where I am, maybe because they are able to do that, because we, for different factors we can. But the cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there's a huge problem with the transition. And this transition was not done efficiently. What I would want to encourage the chairman of the Committee of Health is, one, please do a kamkunji for members of parliament. I am a lawyer and I was here when this was passed. And a lot of us would want to sit here and pretend that we understand and know. Me, there are a lot of things I don't understand about this, and I passed this law here. What about ordinary Kenyans? Do an urgent Kamkunji for members of parliament so they understand what this new system is all about. Number two, we need to actually stop most of the things we are doing in this country so that members of the public understand and know how they can access healthcare. Because healthcare should be the most primary, right for everybody. Because if I'm already dead, how are you helping me? How will it be of benefit to me if I'm already dead? Even if you were to compensate, I will already be dead. So really, I think we need to take this issue more seriously than we are. Let us listen to the cries of Kenyans. If the health system is not working, a lot of the poor people can't access healthcare system, there is a problem. And Honorable Majority Leader, please listen. Please, the transition is not working well. Please take this and inform whoever needs to be informed that they need to take urgent action. The transition is not working well. Thank you, Lillian, for bringing this.
I would request we speak for not more than 3 minutes so that as many of us as possible contribute. The Honorable Omboko Milemba. I have not recognized you.
Thank you, Honorable Speaker. The issue concerning the new model of health provision in this country requires a consortium of all of us to deal with. It doesn't require even people to take podiums on one side and say that this is succeeding, while another team sits on the other side to say it's succeeding, because that will not help us. Another thing I want to say about this is that it doesn't even require statistics, quick statistics of we have treated several number of people, we have done this dialysis. I'm seated very close to the chairman, and he gave a number of such statistics, but even the leader of majority went ahead to give a lot of statistics. I was in a meeting over the weekend where the Minister for Health was called upon to speak on this. Honorable Speaker, she went straight into statistics the way I've seen this happen here, and she lost it. But later on, another speaker came, took her time or his time and spoke about slowly. I was with the Honorable Maungu, and the second speaker really scored. So I really want to remove the first thing amongst members of parliament. There are those who are supporting, those who are not supporting, those who know, those who don't know. We don't know this thing properly. And we need to know it. If we don't know it properly, the local man will not know this thing. And therefore, because I know I have 3 minutes only, the first advisor is to go with Millie. Let's have a Kamkunji. But I had another one, that we need to invite the Minister of Health in this particular assembly so that he may explain to us what is happening outside there. Because unless the explanation comes out, it will be difficult. Honorable Speaker, the other challenge is the ownership of the whole setup. The Kenyans are not willing to own up this particular new model of funding. And the ownership can only be developed if, as the members of parliament will go outside there and explain. And also involve other parties. The chair here talked about is having people within this, and I've asked him informally here, that there are people around who can actually do the mean testing and actually register people. I'm telling you, Honorable Chair, that there are no people registering people in this scheme where I come from. And I have decided, since Sunday, I decided that I'm going to help. So for me, I'm going to go out flat to register all my constituents. But we have to involve other players. Let's not say that we have enough staff. Those CHPs, if they were trained to actually register people in this scheme, it would work. After all, they know everybody. They know the indigent. So even as we do the mean testing, they can actually add up to bring out the whole thing to work properly. And I think that's the direction we need to take with this thing. Otherwise, once the Kenyan person is complaining, we are not safe, even if we give whatever number of statistics. So for me, we need to own up this model, go and explain it, and use every other people within the circles to see how the model can work. Thank you, Honorable Speaker.
The Honorable Karoli Omondi.
Thank you very much, Honorable Speaker, for the opportunity, and thanks, Honorable Lillian Gogo, for bringing this matter to the floor of the House. I agree with the other speakers that the transition has been very bad in this particular matter. I mean, there are already patients with chronic illnesses who are already being served under NHIF. And I wonder why they just never made the full smooth transition into SHA. Because they were already covered, they're already paying their premium, they're already receiving the services. But today they are being asked to register again. And I think this is where the biggest problem is. So we would like to hear from those responsible why there was no bulk transmission of existing members under the previous insurance scheme who had current premiums. And to make matters worse, even those who are enrolling today, they're having difficulties making the payments under the system. It is quite a challenge. You go to hospital, you enroll, you try to pay, you don't go through. But, Honorable Chair, I think the most critical thing is that this new scheme is grossly underfunded and it will not work unless the issue of funding is addressed. The data I have, and Omboko Mulema, please forgive me for using some numbers, NHIF legacy debt is over 30 billion, which is not paid to service providers. How will you convince them to start accepting new patients under the new system, especially the private sector hospitals? The actuarial projections were that about 50 billion would be needed to start underwriting the three funds that we have created. Only 6 billion has been made available of the 50 billion that was required. And as the majority leader said, 14 million members have registered, but only 700,000 have paid. And I suspect these 700,000 are those who have been captured because of employment, not because of being self-employed. Yeah, because they are employed. So basically, we are looking at a new system that is grossly underfunded, projected to cost about 275 billion in the long run to make it fully functional, but is funded at 6 billion. And to make matters worse, we have committed 105 billion to buy a health management software system, information system, 105 billion, instead of committing the money to underfunding the insurance schemes under this scheme. So I think the biggest problem is the way this thing is being funded. And without sufficient funds, I can guarantee you it will fail. It will not work. Thank you, Honorable Speaker. I think we should have the Kamkunji so that we all get educated on this matter better. Thank you.
The Honorable Gadoni wa Muchomba.
Thank you, Mr. Speaker. I rise to thank my sister, the Honorable Dr. Lilian Gogo, for bringing this motion. I indeed had tried to bring the motion this morning, and I wrote to the Speaker, but I was informed that she had done that before me, so she was given the precedence, and I appreciate. Mr. Speaker, I personally went to various hospitals after I got a lot of calls from my voters on matters to do with the denial to access to health. I went to 2 hospitals that are mission run, 1 public referral hospital and 1 level 2 hospital. And I interacted with the patients and I gathered there is a big problem. Whereas we sat here, like Majority Leader says, and we passed these laws, personally I did not pass them because I had issues with one of them. We must appreciate that you don't bring a new law and rush to implement the law without involving the stakeholders. When I went to those hospitals, Mr. Speaker, one of the hospitals told me and confessed to me that they are owed over 200 million by the former NHIF. And therefore they have a problem. I mean, how do you tell me to continue treating patients under a new program and you've not sorted my previous debts? And I know this is a problem. Most hospitals, by the way, the ones that are rejecting patients, they are rejecting patients because they feel that honestly, somebody needed to come out very clearly and tell them, we are migrating. But are we migrating with your debts? Are we migrating with your problems that we have not sorted under former NHIF? So this is the problem, Mr. Speaker. And let us not come here and read numbers. I appreciate the numbers that have been read out here by Majority Leader, numbers read out by our Health Chair Committee, Dr. Robert Pukose. But numbers is not what our people are waiting for. From this debate, they're waiting to hear how are they going to be treated tomorrow in hospitals, Mr. Speaker. Mr. Speaker, when I went to one of the hospitals, I found a patient who was withdrawn from the ward, only to go and queue out for dialysis at 6 a.m. from the ward. And I visited that hospital at 4 p.m. here in Nairobi. And I found that patient in the queues waiting. And he told me the reason why he has been waiting from 6 a.m. to 4 p.m. in the day, it is because, Mr. Speaker, the messages that were supposed to be sent from SHA so that he can be embodied for services were not being accepted. We must tell it as it is. This new program is a total confusion, it's a total mess. Our people don't know what to do, and we must go back to the drawing board. But for now, let us withdraw these processes and go back to the original program until we are right that SHA, SHI, DA,
Honorable Sabina Chege, because of the limited debate time, let us avoid points of order so that we tell Kenyans what to do.
Thank you, Chair, and I want to thank Honorable Lilian Gogo for this motion. And I would say she has been consistent on this matter. I've seen her raise it before. Mr. Speaker, the problem we have with the implementation of SHA and SHI is about the clarity of the transition. Mr. Speaker, when the government decided to move from NHIF and now to the SHA, which is the authority, and with the benefits that we are being given by the chair from SHI to the emergency to the primary care, there was no proper communication and clarity on the benefits. As a former chair, Mr. Speaker, yes, NHIF had many challenges, but when patients visited hospitals, they knew what to expect. So a patient who was to go for dialysis, a patient who was to go for chemo, and who are majority of Kenyans, Mr. Speaker, they knew when they went to hospital what they were to pay and if they were to top up. Unfortunately, Mr. Speaker, when the 1st October came, I also became a victim. I had a patient in hospital, and even with an insurance, Mr. Speaker, it was very difficult to claim what was meant to be NHIF, which now had become SHI under the SHA authority. And so, Mr. Speaker, I would urge the chair of the Health Committee, these members, and I know even your interact with your constituents. It is the high time whether we can even be able to do a public participation.
The Social Health Authority was well intended to ensure that every Kenyan gets access to good health care. But I want to agree with my colleagues that there are challenges in transition. Just like any other program or project, there will be those teething problems when it's being implemented. And I think that is where we should focus. But there are also success stories. Honorable Speaker, I'm just from my constituency. The whole week, I was not in Parliament last week. And I did public participation. And one of the issues I was sensitizing my people on was on SHA. And they said, Mheshimiwa, we did not know. And the information the chair was telling us, we needed to sensitize and educate Kenyans so that they know what is SHA, what is the premium, how do they benefit, how do they pay. That information is lacking. And while we were doing public participation, one of my constituents, when returning back home, broke his hand. And we rushed him to hospital, to one of the private hospitals in town, and we were told we needed to deposit 100,000 cash money, which we did not have. I demanded that the patient is transferred to Bungoma, where we looked for a hospital. We were being told 70,000 we did not have. But before we went to Bungoma, I made sure the patient was registered with SHA. So we managed to get a hospital in Bungoma Hospital that accepted to admit this patient from Busia County, Teso South, and he was treated with SHA, and I only paid 25,000. And as I'm talking to you, he was discharged yesterday. So the problem is lack of information. The problem is equipping our hospitals properly. And Honorable Speaker, the Chair of Health, I want you to listen to me. We must put a proper budget to health so that we are not depending on donor funding. Diseases like cancer, in the last budget, we only gave them 250,000 for both recurrent and for them to establish cancer centers across the country. What can 50 million do? 200 million was for recurrent. So we need to equip. You go to Busia National Hospital, you find 3 mothers from the maternity sleeping on one bed. We must improve the facilities even as we work on improving the transition to SHA. The problem is in our facilities, equipments, and we need more doctors in our hospitals, Honorable Speaker. Thank you.
The Honorable Sarah Korere.
Thank you, Speaker. And Speaker, I want to thank my sister, Honorable Lilian Gogo, for bringing this adjournment motion. Honorable Speaker, as other speakers have said, she or SHA was well-intentioned. But Speaker, the trust deficit that it has brought about, the lack of stakeholder engagement is one thing, Mr. Speaker. And I say so because in every county, in every constituency, we have government officers up to the level of assistant chief. So, Speaker, if all the administrators were called and educated about this insurance fund and given the requisite information, these people are paid by government, the assistant chief, the ACCs, the DCCs. You know, we cannot, depend on politicians who will politicize everything and want to seize the moment, even on things you had passed on this house, just to paint how bad some things are, because they think they are on the other side of the division. And Mr. Speaker, as I stand here, my pay slip has been cut, and so are other civil servants. We feel the pain on the cut, but Mr. Speaker, will really enjoy when our people get services. Every member here, I'm sure every weekend, you are being called for some arambe, even when they know they banned arambes. You are being asked to contribute for some sick person. It is humanitarian. You can't start telling them arambes were banned. And Mr. Speaker, you know, health is not a privilege to Kenyans. It is a basic human right. It should not be a luxury. We don't have the option of deciding whether Kenyans should have a proper health coverage. They must. It is a must, Mr. Speaker. So what am I saying? This thing requires a proper stakeholder engagement. We create proper awareness. The trust deficit, you know, we should be honest to ourselves as leaders. For a very long time in this country, health has been a privilege of the rich. And I think that is what the president is trying to change. It should not be a privilege of the rich. It should be a right of every Kenyan. And Mr. Speaker, we know a healthy nation is a wealthy nation. You know, if our people are healthy, they'll go about their businesses. You know, they will contribute to the economy of this country. So, Speaker, it is not whether we are going to provide them with it. We must. And as a house, we must take responsibility. Those people, you know, NHIF was marred by a lot of corruption. Even as we...
The Honorable Beatrice Elachi.
Thank you, Mr. Speaker.
I'm going to take a lot of time this side.
Thank you, Mr. Speaker. Mr. Speaker, I also rise to thank our sister, Dr. Lillian, but more importantly, for just giving me the opportunity, because last week I walked into the Committee of Health to get to understand. And Mr. Speaker, this health cover is the best for Kenyans, yes. But what we need to understand, and what the committee and our chair of health needs to understand, you cannot have a system where you appreciate the hardware, but you forget software is what will make the hardware work. And that is the crisis we are in, Mr. Speaker. One of the things I need them to come and explain to us, in all insurances, there is a cap. You know, in SHIF, you don't have a cap. So if someone is paying based on your salary, you are just paying. And those are some of the things Kenyans are feeling. They need more explanation. There must be a cap on this. Mr. Speaker, the other thing is that it is time for all of us members of parliament to put a desk in our constituencies. Let us register our people through our community health workers so that we see these numbers, so that we now get to understand, and even as ourselves, to have a tent here, outside here, in our own bunge, for us also to know whether you have registered, yes. But if I go on my phone, it does not show me that this month I was able to contribute the money. So how will I know that I'm contributing? So it needs that system analysis is where there is a big problem. And Mr. Speaker, there is worse problem in the digital one, where we have all these multi-agencies that have brought us into this crisis. Yet we bought a machine for nearly 1 or 4 billion. We should not be in this crisis. We should be now having a health cover, and we should be now celebrating that we have a health cover for everyone, but not going into the crisis we are going in. And then we find putting our president into a lot of challenges because of what we have done. And yet it is just in the Ministry of Health where we have that confusion, Speaker. And this is the time that they must come here through a Kamkunji, realign everything, tell us how the claims management system works, tell us very well how the counties are going to, they are benefiting, yes, but then how do people register for their county hospitals to benefit is very critical. Therefore, thank you, Daktari, but we need a Kamkunji very fast.
The Honorable Guyo Jaldes.
Thank you, Mr. Speaker. I think what we need to know, the concept of universal health care is the best thing for this country, where anybody can walk into any health facility and get appropriate quality treatment is what we all need. And that is what SHA is expected to address. The problems we have today on SHA, and I'm sorry, the majority leader was teasing people. They do not know the SHA, the SHIF, and the rest. And he's the one who's telling them, waving to them, say yes. And they are saying yes because they were obeying his orders. And today, he is telling them that they do not know what they voted for. I wish he was here to accept, to hear this.
Honorable Guyo Jaldesa, so many of us have just agreed we don't understand the systems.
Thank you, Mr. Speaker.
In fact, that is why I'm giving more members of the Health Committee a chance to speak to the public and to fellow members.
Yes. So, Mr. Speaker, Ruku is thinking about what to say. But, Mr. Speaker, this is a good thing. This House approved that motion. It approved through all the 3 readings. And it's unfortunate that our members of parliament do not understand what they passed. And for that, I think we agree that we need to have a Kamkunji for members of parliament so that when they go out to the public, they know what to tell the people of Kenya. We know there are teething problems. Any problem, any project that you are starting as a teaching transitional problem, that it should be sorted out. So last week when we met the SHA team, we said that even Parliament, they should even open a tent here for them to register members of Parliament and their staff, so that they understand these things and ask more, and then they go out to the public and tell them what to do. Final, because I can see the thing is changing. The counties have collapsed, and it's giving us problems. But my appeal, do not close any of the former NHIF branches, and do not lay off the staff of NHIF who have been working for NHIF just because we have changed from NHIF to SHA. Thank you, Mr. Speaker.
The Honorable Gideon Ochanda.
Thank you, Mr. Speaker. Mr. Speaker, the juggernaut that is in front of the nation is basically a combination of factors, but the very basic one is poor learning experiences. We've learned this many times before. You've seen this many failures before, but it's like we didn't learn. So because of that, we have not connected those learning experiences to how to communicate with the public and how to manage transition. So this is basically the main problem that we have as a nation. All these registration processes have failed before. In the last parliament, we placed 6 billion each year for 3 years for purpose of registering indigents. Nothing came out of it. We've seen in the past registration even of basic things like the Huduma number. It failed the nation. So anytime that we are talking about registration of any manner, we must learn from that the past experience to package how we communicate with the public. And that's where the biggest problem is. What because I was talking about is fantastic, but the public don't have it. Who is it that is supposed to be communicating with the public? I don't think it is the member of parliament who is supposed to be communicating the official communication of the government to the public. They can only help, but there's a basic office, there must be a basic segment, there must be a basic department of government that communicates with the public officially about government things. And that's exactly why we have not, the way we have managed, for example, ID, we initially had that big thing. It remains, it works. Then we change to the small ones. So the old one works through for a long period of time. Why don't we have even those registration of NHIF and the rest that we had before work through to the entire period, so that we don't put a stop or an end to an exercise that we know must run on for a long period of time. Even the registration process, even the start date of SHA has failed to pick up in the last 2 years. So those kind of things makes the public not to trust, not to get the information the way they want, so that believing becomes a problem. We must reorganize how we communicate for us to deal with the public. Thank you, Mr. Speaker.
Honorable Dr. Makali Mulu.
Yeah, thank you very much, Honorable Speaker. Honorable Speaker, I just want to join colleagues in appreciating this motion. And I want to say this, Honorable Speaker. I want to go on record that I participated in passing this law, the 3 pieces of law. There are things we objected to. We said they don't make sense, but as usual, our voices were buried. Now, one of them, which is critical, Honorable Speaker, is when you're introducing a new program, if we are programmatic in terms of thinking, there is always what we call the piloting phase, so that you pilot, and as a result of the lessons learned from piloting, then you roll out to the whole country. And I think that's what Dr. Ochanda is saying, that the interface, we missed it. That's why we are facing so many challenges in terms of the transitional phase of it. The second matter, which is critical, Honorable Speaker, you remember the issue of the staff was very, very hot in this, a very hot debate in this House. And we said it's important, we assure the staff, the NHIF staff, that they will be taken care of in terms of transition. Now, we have an authority here which has come on board. They are using a very demotivated staff because they have not come out clear what is the fate of the NHIF staff. As a result of that, they expect them to work as if they are very happy. And these are some of the things you don't get right and you fail. The third point, Honorable Speaker, the issue of the budget. The allocation has been less than a quarter of what is expected. But to make things worse, we come here and publicly announce that we have a digital system which we are going to install, which is going to cost 104 billion. You are telling us you have no budget to roll out the program, and you are buying a digital system at 104 billion. These are the issues, Speaker. So, Speaker, we are saying the government should be able to listen, so that when Kenyans are saying this thing is not working, can we allow Kenyans time? We say let's allow another 4 months so that we have that interface, NHIF and SHA. And if we do that, Honorable Speaker, you find within 5 months, we'll actually phase out NHIF and have SHIF coming on board, but in a very smooth way without really disturbing the process as it is now. Thank you, Honorable Speaker.
The Honorable Irene Mayaka will be followed by the Honorable Andrew Okwome Adepu.
Thank you, Honorable Speaker. And Honorable Speaker, I just want to express the sentiments of majority of members here that one of the biggest gaps in SHA and SHIF is the lack of communication, either to the public, to us, the members who represent the public. Nobody really knows what is going on. And that's the biggest issue that we really need to take care of. Honorable Speaker, for example, the staff who are working under majority of them communicated to them in terms of what is going to happen to them. And this communication needs to be very clear. Honorable Speaker, I hear a lot of members suggesting that we should have a Kamkunji. I actually think that we should have the CS come here during a session so that we ask proper questions where the public can see exactly what is going on. The other thing, Honorable Speaker, is this is an IT-based technological system. And one of the things that we know in the IT space is that when you are moving to a different technology, you have to do what is called a grandfather piloting. What this means is that you pilot in batches. You try one place, if it works, if it doesn't work, you get the feedback, you rectify that, you grandfather that system, and then you move on to the next batch. But this was done en masse, which is very scary and very, very dangerous. And a lot of patients have suffered as a result of this. So what I want to urge the chair and the CS, and I hope he's listening, is that can you now start a process of communication? We have access to social media, we have local media, we have vernacular media. Why don't you use all this that you have access to educate Kenyans properly, to understand this, and also take on the feedback that you're receiving from Kenyans, so that it tells, so that you're able to know what the issues are. Otherwise, there will be no acceptance of SHA and SHIF as an alternative to NHIF. Right now, everyone believes NHIF is what works. So it's up to us. We have the responsibility of ensuring the public understand why this is a better alternative. As at now, we all don't think it's a better alternative. I thank you.
The Honorable Andrew.
Thank you, Mr. Speaker. In fact, I'm surprised that some of us do deny that people are suffering out there. I'm telling you, the situation out there is very serious, and because of that, I'm happy my colleague, Honorable Gogo, brought up this issue. One thing that I see is the cause of this problem is changing of names from NHIF to SHIF. Perhaps the system should have worked in such a manner that the two systems were to run concurrently as NHIF gives way to SHIF. But if you make it one day, a number of people were caught up. They were neither in NHIF where they were deregistered, nor are they in the new system of SHIF. So when illness comes, when a disease comes, they are just, their fate is death. This we must accept, because if somebody is nowhere, then it's not registered. And with that situation, I would say that the government must take this thing very seriously, because even as I speak, there are many people who are not registered anywhere. I think this we need to do something on very, very urgently. And in addition to that, a bad mistake was done that there was no public participation adequate. There was none. So people know what's going on. That's why you hear SHIF, SHAF his whatever. This is because of not knowing what is going. So, Mr. Speaker, sir, let me say we need to reverse the situation in a way that everybody can be given a chance to live.
Honorable Andrew Kwame, your time is up. The Honorable Wilberforce Oundo, in 2 minutes.
Chair, I have been on top of the log for long, but it's okay. Honorable Speaker, I think there are two issues here that the committee and the executive needs to address. One, majority of the hospitals have got legacy debts from NHIF, and probably there isn't sufficient legal mechanisms to transfer the liabilities of NHIF to SHA. So you find that many hospitals, therefore, are no longer, are not happy, are not willing to take up more responsibility and more debts. So it's therefore important the executive needs to assure service providers that whatever you are owed by NHIF will still be taken over by SHA after the due diligence process is completed. Second, Honorable Speaker, yes, we might have insurance cover, but if the primary facilities do not have adequate resources, then the entire system, Honorable Speaker, is going to collapse. So for that, because we are running short of time, it's a good idea. Let the executive work on it so that we resolve these issues. Thank you, Honorable Speaker.
Lastly, the Honorable Eric Muchangi.
Thank you, Honorable Speaker, for this opportunity. I wish to thank the Honorable Dr. Lilian Gogo for this very important matter. Honorable Speaker, I wish to agree with the honorable members that say that we need to do more sensitization and information sharing about SHIF. Because, Honorable Speaker, I have done my own research within my constituency, and I have seen that we have some considerable number of people who are taking this SHIF, but there are challenges that have come with this new program. And I am thinking that sometimes we have a very ambitious program of planting trees in this country until everyone gets into the program of planting trees. And on this issue, important issue to do with healthcare, I believe that we should, as a government and as leaders, invest more time in educating our people, because we need more of them to get enlisted in this program, and we should not fear that this program is new. You know, in this country, we have a tendency of rejecting almost everything. This idea of having a new
that was made to be paid for those hospitals that were not paid their NHIF. What happened to the money? They should be paid. How can I give you service if you have not paid me what you owed me previously? Mr. Speaker, we need to look at it again. We are not saying that it has failed, but we need to review and see what can be done to give Kenyans the universal health coverage that was promised. Thank you very much.
Order, honorable members. Honorable members, the interest on